Uganda has become the first African country to host a continental summit focused on ending the transmission of HIV, Hepatitis B, and Syphilis from mothers to their babies. The Triple Elimination Conference, held at Speke Resort Munyonyo from July 21st to 23rd, brought together leaders from over 30 African nations, health experts, civil society organizations, and global partners committed to maternal and child health. The three-day event, organized by Uganda's Ministry of Health in collaboration with the African Union, World Health Organization, UNAIDS, and Africa CDC, aims to align efforts across the continent to stop these infections by 2030. Dr. Diana Twine, Permanent Secretary in the Ministry of Health, described the conference as a turning point in how African countries approach maternal and child health. This is about creating a future where a child is born with HIV, Hepatitis B, or Syphilis. We must treat these as one battle, not three separate ones, she said. The ministry says Uganda has already made gains through its prevention programs, including expanded testing for pregnant women, wider access to antiretroviral treatment, and the routine administration of hepatitis B vaccines to newborns. Unlike previous strategies that handled each disease separately, the triple elimination model promotes combined testing, treatment, and follow-up, making it easier for healthcare providers to offer services during antenatal visits. Dr. Robert Mutumba, who heads the AIDS control program, explained, "We are integrating services so that no mother has to make 3 trips to 3 clinics. One visit should cover it all: HIV, syphilis, and hepatitis." Across Africa, hundreds of thousands of newborns are still exposed to preventable infections, while mother-to-child HIV transmission rates have fallen in many countries. Syphilis and hepatitis B remain neglected. According to WHO, over 250 million people globally live with chronic hepatitis B, and untreated maternal syphilis causes thousands of stillbirths every year. Dr. Charles Olaro, Director General of Health Services, said Uganda's decision to host the summit reflects both its progress and remaining gaps. "We have reduced new HIV infections among babies, but unless we tackle the full spectrum, our progress is incomplete." Civil society groups also played a central role. Kenneth Kabagame, head of the National Organization for People Living with Hepatitis B, emphasized the agency of local solutions. "We are finally seeing domestic investment in treatment and even steps toward local drug production that changes everything." The conferences also spotlighted the challenges of stigma, supply chain gaps, and limited health work training, especially in rural areas. Delegates agreed that financing and political will remain crucial if Africa is to achieve triple elimination within the next 5 years. Participants left the summit with a draft continental roadmap, setting shared targets and calling for annual progress reviews. Uganda's leadership was widely praised, with many health ministers pledging to adopt integrated service delivery models in their own countries. As curtain closed on the Namono summit, the message was clear: Africa is ready to move from fragmented responses to united action so that every baby born on the continent can have a disease-free start in life. For Science Television Network, I am Namono.